About 10 years ago, I had a bridge placed because on one tooth I had a receding gum line and I could feel it, but the bridge didn't last. I did it twice and it didn't last. And then my sister had receding gums and she had a surgical procedure and she explained it as very painful. So I did not pursue that route, and with having 4 kids and being diagnosed with diabetes, I kind of let my own oral care go where I didn't see a dentist for a long time. So when the pain got to the point where if we posed for pictures outside, if the wind blew, it would hit my teeth and it was just sharp, excruciating pain. And I'd be standing there, please take the picture, I can't be here anymore. And then I knew I had to do something. I mean, I already had trouble eating foods. I couldn't do hot and cold, couldn't bite into an apple. Brushing my teeth was making me cry. I had to do something. I couldn't keep going on. So I went to just a general practitioner, general dentist, and when they were doing my cleaning, they had said that there are new procedures out, not the same one that my sister had done, and they had told me about the pinhole procedure and that Dr. Weber was the person to see. This was the first time I've ever walked into an office. They showed me everything, they took me back, and I was terrified. I really didn't know what to expect, but they were so sweet, they were very kind, talked to me about everything that they were gonna do, didn't get mad at me for my lack of coming to see a dentist for a long time because I was terrified they'd yell at me. And then Dr. Weber was great. He was so nice. I am a nurse by background, and his bedside manner was just amazing. He was friendly, he chatted with me. He wasn't pointing fingers like I've done something wrong, but he was digging into my background to see what may have caused this. He was very honest about what could happen if I didn't get treatment, and he was also very honest about what he could do and presented everything very clearly, very easy to understand. But he explained that they'd be making tiny little holes up in the gum line so that he could pull the gums up and implant the tissue underneath to allow for it to adhere to my natural gum, to allow for a better chance of it growing and being a natural part of my mouth and having better results. Things are much better. Actually, I did great from the get-go, but I'm a rule follower. Everything they told me to do, I did. Elevated, ice, kept the pain medicine. I was really not in a lot of pain afterwards. I did not swell very bad afterwards, but I followed things to the letter. I did not brush my teeth until they told me I could, and it has done great. It has done better than he thought it would do, because we knew we couldn't return back to normal, where the gums were exactly where they were supposed to be, but we're close. We're really close, and he didn't know if it would actually do that well. So they look great. I can smile, I can eat, hot and cold doesn't bother me, I can brush my teeth. The pain's almost gone. I mean, it's nothing like what it was before. I think my only regret is that I waited so long. It's so different. It's so different to be able to smile outside, you know, to go to a football game and laugh and cheer with my kids and smile and not be in pain. It is so nice to brush my teeth at night and not be crying. It's sad that I waited so long, but it's wonderful that they could do something and that it wasn't too late. I would absolutely recommend Dr. Weber and his whole entire staff. They are not only friendly and putting you at ease, they talk to you and they take time to know how you're doing. When I would come in for post-op visits, they wouldn't just, oh, sit down and wait for the doctor. They come and sit with me and really ask me how I'm doing, if there's really any problems, if there's anything they can do to help. The care that I received was the highest quality that I've ever received in a dental office.